This morning, getting screened for breast cancer is important, but not everyone has the resources or ability to get tested. And that's where Alicia Giaimo comes in. She is a clinical professional of diagnostic imaging at Quinnipiac University. She is here today to talk about a very important issue and about her role in an international effort to expand breast cancer screening and training in Guyana. So great to have you here. And this is not only a professional topic for you, but also a personal one, as you are a survivor of breast cancer.
I am, yes. And it's just my passion. It has been for a while, and it was renewed 5 years ago when I was diagnosed.
Congratulations. What was that experience like for you, and why do you want to spread the word so that you can save other lives out there?
My experience was definitely different maybe from the norm because I do have some background knowledge in the area, right? I've been doing this for quite some time. And so I got to look at it from a patient perspective, but also professionally. What are the things that we do as technologists that could maybe impact someone's hearing it for the first time as they're navigating procedures and the exams, and even when they come back for that first mammogram after everything, there's a lot of anxiety there and nervousness. And so being able to kind of share my story, right, to help technologists understand that a little bit better.
And you're here today in large part because of early detection programs that we are so blessed to have here in the United States. Access is a little bit difficult in other places around the world, specifically Guyana, where you went down to about a couple weeks ago now. How was that experience like for you, and how did it come to be?
Eye-opening, really. We are very fortunate to have access like we do here. Guyana is one of the world's third smallest countries, but very much they were lacking any type of screening program at all. Wow. Earlier this year, the International Atomic Energy Association helped them secure digital mammogram equipment. They have 4 now, which is new to them. And so they're helping make better strides. But at the time, more than 90% of the women in the country had not ever had a mammogram. Wow. And we know early detection is key. And so this is the first step, hopefully, in a longer list of steps for them to continue to improve that and just in general the health of their women in the country.
And you were there for a week. What was the goal of that visit?
So our goal was to train the technologists that are going to be performing the exams on how to properly position, how to get really high quality diagnostic exams, and then also how to take care of the equipment that they just got.
That's part of it.
Yeah.
A big part of it. So it was largely educational and purpose. And what was their reaction to your visit?
They were so welcoming, and the technologists were lovely. It was really nice to see how eager they were to learn and absorb all the information that we were sharing with them. They asked really good questions. They were 100% engaged, and it was really nice to see.
So you made an impact, to say the least.
I hope so. I will say that they made just as big of an impact on me with just a renewed conviction for making sure that people are doing what they're supposed to do to stay healthy.
And for women and men watching this morning, what can you tell them about early detection, to go get their mammogram, when it's scheduled? Why is it so important to take this seriously?
Early detection saves lives, right? Cancer affects everyone. Everyone probably has been touched in some way, right? And we know that breast cancer is curable when caught early, right? And we can only do that if you're doing your screening as scheduled and you're working with your team of physicians, right, your doctors, to get screened and be reminded, and having access, right, is the biggest issue.
Absolutely. 5 years in remission. Congrats to you.
Thank you.
We hope that continues, and thank you for spreading the word about prevention efforts. It really can save lives. So appreciate you coming on this morning.